Hello, my name is Kim Mills Garcia, RN. The University of Phoenix course that discussed the importance of research, article critique, and presents the need for evidence-based research in nursing practices. I am a student that researched this article, Management of Relief of Pain in the Emergency Department from the Adult Perspective, Volume 25, Number 6, June 2003. Journal of Pain and Symptom Management. This was conducted in France. I do not speak French. I'm not going to try to enunciate the doctors or the nurses' names that participated in this research. They are on the prompter. Overview of the study. This university hospital in Paris had a great concept to assess the patients at the beginning of their emergency room visit. They wanted to measure a before and after pain management assessment to ensure that their pain was addressed and managed. The consents were obtained at the beginning and the participants were protected for their safety and their welfare. The article proves the patient in the emergency department are getting proper pain management. This is also a concern in the United States as well. We are focused on disease and pathogen to prevent further damage to the body. We forget that the patient's needs to feel comfortable and having pain addressed is equally important. This patient satisfaction is an area of concern for hospitals nationally. This qualitative research aims at addressing the need to improve pain management in the emergency room setting. Of the 810 eligible patients included in the survey, 90% completed the questionnaire. Age, sex, time of arrival did not differ. Patients between the ages of 18 to 97, average age was 37, 50% male. The length of the study may have been short, but 90% is a high number of respondents for pain management data collection. This provided a strength into a short study period. Some of the interviews were not obtained due to the urgency of their emergency. But after a medical examination and before discharge were conducted, the privacy to maintain the patients into a private area for interviewing were missed at the arrival portion due to their emergency. Prisoners and patients under arrest were excluded from our study. As consent is required in French law, participants in the clinical study and we did not consider these patients free to give their consent. All other participants were of age and consents were obtained for the article research. Relationships between theory, practice, and research. Of the 563 patients who complained of pain at arrival, 362 patients assessed their patient's pain on both scales. These two scales were found to be correlated. 384 patients underwent intense pain evaluation from the first interview and prior to discharge. These patients' insufficient pain relief was addressed at 77% of cases. When the patient is complaining of pain, the nurse should be addressing this with the patient and the physician. The relationship between the theory, practice, and research are closely related when discussing pain and management of a patient's pain. We found that patients with moderate to low pain were relieved less often and were less likely to receive interventions before, during the examinations than patients with intense pain. Furthermore, moderate to low pain was independent associated with insufficient pain relief on discharge. This article shows with the patients leaving the ED with significantly high levels of pain. This area is a need for quality improvement of patients' comforts and needs. The research study of evidence-based practice and outcome change. This article showed the readers how much pain is not addressed for moderate to mild pain levels in their emergency room visits. Some changes in everyday practice are required to improve management of moderate to mild pain. The care provided should be by a trained individual and consider the pain of moderate to mild as intense as the most severe. According to the article, early analgesic administration before medical examination should be investigated in terms of safety and efficiency. In France, nurses are not legally authorized to prescribe medications unless there is a protocol that specifically determines the details of analgesic administration, even though they're well trained, suited for symptoms of management. Lastly, the issue of collaboration is needed with the emergency room team. Healthcare education programs on pain management should implement improvement for patients' knowledge and promote collaboration between patients and healthcare providers. Thank you for listening to my presentation. That is my critique.